think this has been a good year. We've done a lot of work on a number of areas, and I think that the fact that we have many different threads coming through reflect that we have an ongoing commitment to work on alcohol, tobacco, climate change, transport, social determinants. And a number of those actually interrelated. So for example, looking at fortification of flour with folic acid, or adding vitamin D, giving vitamin D treatment for people with rickets and osteomalacia are really quite important. But they have an interrelationship on where is it legitimate to treat the whole population, or how do you select individuals from the population. And it's refreshing to actually get some new issues in, but it's also a recognition that we're producing material that's useful for the members.
But no fat tax on unhealthy food?
No, it's very interesting, the one on fat tax. It was no fat tax on new foods, but let's tax foods that are very high fat now. Which sounds a little odd, but I think what they were saying is we would need to see the evidence that on new foods that this was the best way to go. And certainly a lot of support for doing things with, for example, supermarkets, to trying to make sure that they actually produce healthy foods that are cheap rather than have all the unhealthy foods that are cheap.
And quite a lot of focus on the roles and the lives of children.
Yeah, we're doing a new report at the moment that's due out late this summer on children 0 to 5, an update of a previous report, and absolutely this recognition that children's lives are absolutely essential. We form all the likelihood of different diseases before we're born and in our early childhood. A lot of that will be reflected in the new report, but that's why keeping children at the heart of everything is now an essential part of all that we do in public health.
Should we be surprised that doctors are in favour of children being taught how to resuscitate people?
I don't think we ought to be surprised, because one of the things we know is there's been lots of really good evidence that you can teach everyone, young people and older people, how to resuscitate. And if you are going to resuscitate someone, the faster you do it, rather than waiting for the paramedics to arrive, the more likely you are to be successful, and that's really important. Just think about things like somebody has an electric shock perhaps in the house. If your child is there, witnesses it and can resuscitate you, you may survive. And if they don't, and even if your child knows to dial 999, you may not get to hospital in time to be resuscitated, or the paramedics may not reach you. So it's an important extra attribute.
And perhaps most significantly, there was a reaffirmation that the BMA supports the work that is being done on inequalities in healthcare. But they've also voted for a Tobin tax. Can you talk to us about that?
Yes, the Tobin tax is a tax on financial transactions. And the concept behind it is that by putting a tax as a tiny, tiny percentage on all financial transactions, you start to raise money for government to use. But the point here is that that money should be used for what you might call good causes. So that could be, for example, to make sure that the government has enough money to spend on international aid, and in particular to reduce the health inequalities that we see globally, and to make sure that the Millennium Development Goals get reached. But at the same time, it could add extra money for the National Health Service, or for schooling, or for making sure that school playing fields stay there. And it's a very interesting concept. The other thing that we'll need to do is now do some work on what are the areas we want to say that if there is a Tobin tax, that money should be spent on. Where can it best have an effect?
Is this going to be seen, though, as doctors ganging up on the bankers?
I don't think it's ganging up on bankers. I think it's trying to use something which might actually help all of us without us paying an individual tax, without our personal income tax levels going up. Actually doing something that's for public good, and predominantly in the country. But that's why before we do any work to promote this, we will do some work on thinking about how can we best say that money should be used so that you get the maximum benefit to the whole population.
Dr. Vivienne Nathanson, thank you very much.
Thank you.